Hi, everyone. I'm Dr. Evelyn Burrell with Psych Docs. I want to thank you all for tuning in as we talk a little bit about what's going on these days for the holidays, between it being COVID, a lot of concerns regarding illness and safety and travel, and our holidays are looking really different this year. So we're going to actually have quite a few guests joining us today to talk about and offer some expertise surrounding these issues and some of the concerns that we're going into the holiday season with. So first, I want to introduce the lovely Dr. Michelle Milton. She is an amazing friend and colleague, and I'm so excited to have her in my life and be able to hang out and have these discussions with her. So Dr. Michelle, Dr. Milton, why don't you come on in?
Hi, good afternoon, everyone. Welcome back. We survived the election. At least the day of the election. We here now.
Yeah, we here now. We're still trying maybe to get past the hump of election, but right. One thing at a time. So I was like, all right, we got the rest of that's just going to probably lag for the next month or two, and then maybe we'll figure out where to go.
Exactly. We're in today, and I'm good. That's
all we got. Yeah. All right. Next, I'm going to bring in Dr. Angela Kenslow. Again, another amazing woman who is offering a lot of her expertise and information regarding COVID-19. She is, I think, in the back, kind of getting everything going for us. She's our handy lady. She does basically everything.
Everything tech.
Yeah, everything tech. I try it, and then she's just like, let me fix it.
I'll take it.
Hey, Dr. Kenslow, how's it going?
It's wonderful. Thank you. Thank you. This is great. And I did hear Dr. Milton. Yes, the election. Whew. I'm so glad that we had an opportunity to share with folks prior to the election, just kind of how to manage that stress and how to get through it. It was definitely needed. I'm sure not just for our audience, but I know it was needed for me as well.
I discovered a new Netflix series called The Midwife that I probably never would have watched unless I had like an intention of getting my focus on something other than watching the news. So, and it's pretty entertaining, very interesting.
Good for you. I haven't watched The Midwife. I'll have to look into it, but definitely like that pre-planning of what's to come, of what is this potentially going to look like for me and for my family? And how do I make sure that I'm keeping myself and my loved ones kind of in a safe space, mentally and emotionally as we kind of push through that. And so being able to prepare emotionally and mentally, it was just so helpful to have an opportunity to do that.
Yeah. Well, this month, we're talking about COVID and the holidays. And I know we just had a holiday that just passed, and some of our pre-conversation, we were talking about how a lot of folks actually did travel when it came to Thanksgiving, and how now the CDC and other organizations are making predictions as to numbers starting to increase. And so I know that we wanted to talk a little bit about how to manage getting through the holidays during this pandemic. And this month, we're switching it up a little bit. We each have invited an expert to join us in this conversation. We realize and we recognize that, while this is the 3 Psych Docs, there's definitely others out there who are able to contribute. And we want it to be able to bring some additional voices to our audience to be able to help everyone kind of get through the holidays. Again, during this pandemic, this is a first for, I'm sure, all of us, unless you're a centurion. And if you are, you're probably not watching this.
They might be.
They might be.
I mean, the centurions are still hanging out, trying to figure out what they're doing with the holidays as well. And are likely the ones that are being the most impacted to some degree by everything going on.
Yeah. Yeah.
When I think about managing and coping, one of the first things that comes to mind is being able to manage the traditions or my expectations. about what the holiday season is supposed to be, right? And I think a lot of times I could want it to be structured in such a way, like this is the time for gathering, the time where I get to see people, the time that I get to go out to the stores and have fun shopping if you like to do that. But thinking about how I need to shift some of what I usually do and what I expect the day or the celebrations to look like. And that's not always an easy shift, especially if I acknowledge the COVID fatigue that is present, right? Like I am tired of being careful. I'm tired of, being kind of cooped up, if you will. And so that fatigue of, I just want to break out sometimes, that can lead to, more careless behaviors. And so always having to be careful, always having to, make sure that I'm washing my hands and trying to get things done. It just can be a lot in managing the expectations of what the season is supposed to be and continuing to be in prolonged, stressful moment in our lived reality.
That's perfect. The prolonged, stressful moment. It went from, I think, being a moment earlier this year to being really just kind of a lifestyle. And we keep getting hit with these new realities of the change. Over the summer, it was, wait, what do you mean the lakes and the beaches are closed, right? And I can't travel or whatever I may be looking forward to, or the community pool is closed. And when my summer plans start, what happens there, to now we're in fall, moving into winter, and it turns into, well, what do you mean? Christmas shopping is becoming dangerous, that stores are starting to shut down, or that maybe I have to trust everything on to be mail delivered. Not everyone is in a place to have just things delivered and sitting in their front door, for God knows how long. What do you mean I can't hang out with my family? My grandmother or whoever can't come and see me, or these children aren't in school and I'm still doing the distance learning with them. Or in some instances, my kids were in school and now all of a sudden they're not. And I have to figure out what that means now to change that whole process on top of everything else. So it's almost like we're in this continuous change, and it's really difficult to prepare for, because we want so badly to get back to kind of our normal life, but we can't do that now. We have to get a whole other idea as to what our options are. And that's sad. And that's where you start seeing the grief, and the sadness, the depression, the anxiety starts coming back around again. We get used to it. And we're like, oh, well, summer's over, not much going on for fall. And then now winter, it's that resurgence of the emotional and mental hurts that come from everything that we're experiencing.
I have to say, I think I actually, this Thanksgiving, so my mother is in assisted living, and with her being in assisted living, we actually haven't really been able to see her in person up close since March. So I video chat with her often. On her birthday, we were able to do a drive-by at a very large distance and everyone masked up. And so with Thanksgiving, we were not able to spend time with her. And so for me, it just didn't really feel too much like a holiday for the majority of the day. And then I went to my son's home, and, there was lots of family who were there and everyone was enjoying everything. But I didn't stay too long. And then I called back my mom and just kind of trying to keep checking in on her and, see how she's doing. And I think sometimes we forget, right? We forget the people who are in these vulnerable populations who at some point, this video chatting, this Zooming, this FaceTiming, this Facebook video messenger is fatiguing, right? It's great. I'm so grateful and I'm so thankful that it's available. Otherwise, I can just imagine how much harder this would be. But it would be so nice just to be able to, wrap my arms around people who I love during the holidays. And I'm sure there's a lot of people out there who are feeling the same way. And so, these holidays can be tough. They can definitely.
Some people haven't been touched. We need physical touch. There's people who've not been touched. And hugged and loved on in months. And again, those are the things that start to really, really take a toll. And typically around the holiday season, we start to see, surges in depression and suicidality. And, you know, we're moving into that with COVID on top of everything else.
Mm-hmm.
Well, like we mentioned, we have some wonderful guest speakers with us today, and I would love to be able to introduce, hailing all the way from Virginia in our virtual platform.
Yay, virtual.
He is a best-selling author of Split Second Decisions. He's an emergency room doctor who has been on the front line of COVID since this thing has begun. He's been giving out information continuously on lives, trying to educate the nation and the world on how to stay safe. So please let me introduce to you and reacquaint to others, Dr. Geoffry Mount Varner.
Hello, doctors. How are you today?
Welcome.
How's it going?
Well, first, let me say I enjoy listening to you all. You all speak in very calming ways. I actually felt better mentally.
Wonderful.
Awesome.
Well, thank you. And I know, I invited you to join with us today and really wanted you to be able to take some time as we're talking about COVID and the holidays on how people are able to stay safe, how we're able to keep our loved ones safe, how we're able to keep ourselves safe and our community safe when it comes from a medical standpoint.
That is a great question. I'd like to thank you for letting me appear on your show. But I also wanted to thank you all because as you all have talked about, the third pandemic, which is going on, which is serious, is the mental health part. But you all are handling that. But that part is extremely serious, and we see that play out in the ER. As it relates to COVID and the medical aspect and the holidays, I think it's very important for people to just keep in mind that things have not gotten better in any type of way. In fact, things are much worse than what they used to be. I don't say that to scare anyone. I say that so that people could hunker down and be ready, because in the end, this will be okay too. So just follow me real quick. Believe it or not, I'm sure you all get it as well. I'm still getting these questions about if masks are safe, so forth, and so on. So I am a little shocked that that's still going on. But let's just talk about, as we go through the holidays, understanding the symptoms are extremely important. And here's why. If you understand the symptoms and know what they are, and especially the new ones, it means that you can identify someone or even yourself earlier and isolate faster and keep from infecting other people. We already know about the cough, sore throat, fever. Everyone knows about that. Pause. We used to say that about 50 to 80% of people were asymptomatic. Well, the newest studies show only about 15% of people are asymptomatic. What's going on is that people fail to recognize these symptoms. That's what's really going on. We already talked about the cough, the sore throat, the loss of taste. We all get that. But the other common ones that we don't really talk about are a headache. If you usually don't have a headache, if you suddenly start having headaches, you should think COVID. I'm not saying you have COVID, but think COVID. And general fatigue, just all of a sudden feeling tired. Mm-hmm. That's something to really think about. Do I have COVID? 56% of people have general fatigue. And something that you all touched on, and it's very common in the elderly, is sudden confusion. Sudden confusion in the elderly. 27% of those over the age of 65, the only sign of COVID is sudden confusion. Does that make sense to you?
I had no idea about that.
Yeah. And then let me make your viewers feel better as well. If you all don't mind, give me 2 more minutes at least.
Oh, you're good. Yeah.
The studies are all over the place. The information is all over the place. And let me just share with you. I'm a crisis and split second decisions expert on the front lines. I'm an ER doctor for 25 years. I've done about 150 shows as it relates to COVID. The reason why people follow me is I only present information that comes from peer-reviewed academic journals, Dr. Fauci, or the CDC. There are 3 vitamins that you can take that have been proven to not only prevent COVID, but if you're home treating COVID, it makes you less likely to get sicker. Real quick, those vitamins are vitamin D. We already heard about that one. That one prevents. And if you get COVID, it makes you 10 to 12 times less likely to die. 10 to 12 times less likely.
Wow, that's significant.
Yeah. Isn't that a lot?
Vitamin D.
Then the next vitamin is zinc. Taking zinc is a prevention as well. And then if you get COVID, home treating with zinc, and it's obviously a different dose. And then the final one is melatonin. It helps with the prevention. And if you get it, there's a different dose. It also helps with anxiety as well. And I tell you all that, and I share all that with your audience to arm them, to help them feel better as well.
Thank you. That the only thing that I knew about was the vitamin D, and I think I've heard you talk about zinc before, but I didn't. You brought it back to my recollection. Had no idea about melatonin. So thank you so much for that.
Yeah.
I know stop
Very much so.
house.
All over the counter, all easy enough to get to. Like obviously quite available vitamins that, I mean, sounds like can be kind of a front line of defense, especially if you're out, if you're around other people, if you're exposed pretty regularly to I guess civilians, to anyone.
Thank you.
And I also, if I can ask just one more question, take one more moment of your time, Dr. Geoffry. I really appreciate you sharing what sources of information that you then pass on and share to your audience and viewers. I'm wondering if you have other recommendations about how people can stay informed without being overwhelmed with the amount of information that is out there.
That is a great question. This is going to sound odd. The first thing that they can do is watch less TV.
Yeah.
Because if you watch too much TV, you get too many different sources and it increases your anxiety. And I would love for people to follow me at YouTube/Dr. Geoffry. I would love to. However, the best and most reliable sources that is often changing is the Johns Hopkins COVID site. The Johns Hopkins COVID site, if you just Google Johns Hopkins COVID, they give you moment-to-moment updates. I found it reliable and clear and easy to understand. And just one more piece, because you all touched on it. This COVID fatigue is real. And as I was just on a different program talking about it, for those people who are COVID negative and who have been COVID negative, this is the worst time to get tired because help is right around the corner. You've made it this far. So the last thing you want to do is to get COVID now when you could have prevented yourself from getting COVID.
Yeah. Dr. Geoffry, we have a question from one of the folks, and I don't know if the peer-reviewed articles provided this information or not. And I know that you're not here to make any prescriptions, but the question is, in what doses, by Stephen Harris. So Stephen Harris is wondering what dosages of the different vitamins that you mentioned should we be taking?
And Angela, Dr. Kinslow, thank you very, very much. Forgive me if I call her Angela, but she and I have done several shows.
Yeah.
So we've gotten on a front basis. Yes. But Angela, thank you for setting it up as well. Anything I say is for information purposes only. None of it is like medical advice. I'm sure all three of you all can like
Absolutely.
So to your audience, just follow me real quick. For the vitamin D, the prevention dose, the protective dose is 1,000 to 2,000 units per day. 1,000 to 2,000 units per day. Okay. For zinc, for the prevention, is 30 milligrams per day. For the melatonin, for the prevention, it is 0.2 to 2 milligrams at night. Those are the prevention doses. And Angela, do you mind if I drop a link that people can go and look those up as well?
Absolutely.
Right. I'm going to put it in the chat now. And then now, follow me on this one. If you're home treating with COVID, meaning you are COVID positive and you're home treating, the vitamin D, it's 2,000 to 5,000 units per day. Pause. Just as a side note, Dr. Fauci takes 6,000 units per day just as prevention. But the current recommendation is 3,000 to 5,000 units per day for treatment. And then for the zinc, it's 75 milligrams per day. And then for the melatonin, it's 6 to 10 milligrams at night, 6 to 10 milligrams at night. Just as a side note, just real quick, doctors, if you don't mind me just talking about the vitamin D, because people don't really get this. The darker, so most of our vitamin D comes from the sun, vitamin D, but the darker you are, the less efficient that your body is at converting sunlight to vitamin D. So it's more likely that the darker you are, it's more likely that you're going to be vitamin D deficient. And elderly people, as they get older, of all colors, because of their skin changes, is they're not able to efficiently convert the sunlight to like vitamin D. Hence, 82% of people in this country are vitamin D deficient. I'm sorry, 34% of people in this country are vitamin D deficient, but 82% of Black folks are, 70% of Hispanics are. I say all that till I say that vitamin D, it's not because it's a vitamin, it plays a huge role in the immune response.
Yeah.
So just because we live in Arizona, because I'm outside all the time, so I don't worry about my vitamin D. I'm legit almost always outside. But what I'm hearing is that I shouldn't assume just because I'm in Arizona and that I go outside that I'm fine within my intake.
So I have to say that I'm also here in Arizona and I love being outside. I know that you run all the time, so you're outside a little bit more than I am. I was vitamin D deficient. So my PCM gave me 12 capsules. I forget, it was like mega doses I took once a week. And so we just drew my blood again yesterday. So I won't know for a couple of days to see where my vitamin D levels are, but I'm sure I'll continue then not on those mega doses, but more on a daily dose rather than the weekly dose. So, yeah. Well, Dr. Geoffry, thank you so much. I appreciate you. Thank you for taking this time out of your day to share with us and our audience. You have, again, been on the front line since the beginning. You're seeing folks as they come in. So I can only imagine what that's like for you. So I just appreciate everything that you've been doing for the community, for the nation, when it comes to providing accurate education when it comes to COVID-19. So thank you so much.
Thank you so much for your time. It's been such a pleasure. Thank you.
And thank you for having me
Grateful for you
on your show. Believe it, and thank you so much for what you all do, because your work is going to get harder and harder because this mental health crisis going on. We really need all three of you all and many people who look just like you all as well.
Thank you.
Thank you.
Have a great day.
You too. Bye. Ooh, that was gold.
He's phenomenal, isn't he?
Yes,
Yeah.
very much so. Very grateful for him. And I really also appreciate him acknowledging fatigue as being a part of the physical. And as we're going into the seasonal, the winter, and knowing that depression can increase, knowing that fatigue is a part of depression, it underscores even more how much you need to be in tune with your body, what's going on and how you're feeling, and attending to those things when you're noticing it's a bit off. So appreciate that.
Yeah, just getting back into yourself. And then really, I think that from a psychological standpoint, so headaches, fatigue, all of that, again, is linked to depression. It's linked to anxiety. And recognizing that, hey, just because you have those symptoms doesn't mean that it's a mental health issue. There might be something else that's going on that needs to be looked into first. And so for any psychologists, counselors, therapists out there, making sure that when someone comes into your office and they say, oh, I've been having these headaches, I'm doing all this, when we're doing our diagnostic and clinical interviews, that part of that should be, have you seen a doctor and have you spoken to a medical doctor about what some of these symptoms are, to maybe make sure that we're eliminating a medical issue before we really start focusing on the mental health stuff. Yeah. Sometimes it's both, Yeah,
and whenever I have someone who is complaining of physical stuff, if they haven't already seen their primary care provider about those particular symptoms, I'm sending them to them
every time. Yeah,
I want to rule out medical stuff first, right? So I know we have some additional guests. I'm not seeing them available just yet.
Okay, well, that's fine. We can talk. I'm just saying, I'm like, that kind of stuff was gold. I was thinking like, I had to test recently because my kids, unfortunately, were quarantined from some other issue, right? So they're negative, they're fine. But I found that over the last couple months, I've actually had this low-grade headache, which is very unlike me. I don't typically have headaches. It's just been kind of consistent. So when he said that, I kind of panicked, like, oh my God. I had like this internal process kind of occur. And then I thought, well, wait a minute, I actually just got tested right before Thanksgiving. Like, it's negative. But again, it's that piece of, okay, then if it's not that, then we need to figure out what other beast it is that we're dealing with right now. And if it's not, COVID or illness related, physical illness related, then we really need to be looking at other, mental health kind of issues that might be going on at this point. So there's always something that we need to be looking into.
Yeah. Dr. Melton, I believe your guest has arrived. So if you would
wonderful.
Like her.
Yes. So joining us will be Dr. Leo Caraballo. He is a clinical psychologist at Walter Reed Hospital in Bethesda, Maryland. So he'll be joining us from the East Coast as well. And he is an amazing and talented clinician, as well as holding many leadership positions in psychology to make sure that we are promoting well-being and mental health in the communities that we serve. Most importantly, for me anyway, that he is my brother friend. And so please welcome my brother friend and colleague, Dr. Leo Caraballo.
Hey.
Hello.
Hey, welcome.
Welcome.
So we've been talking about, just taking care of ourselves. And we heard from ER doctor about some of the medical things to take care of. And we've been talking about mental health aspects, but I want to ask you if you can share some insights on a particular experience. And I'm going to share a little bit of a background here. So I'm noticing in myself and in engaging with other people is that how we treat one another continues to have a bit of an edge to it. So when I'm out, I will side eye someone that doesn't have a mask on, right? And I'm hoping that communicates some things. But I also found that I can get a bit anxious if I need to sneeze or if I cough, and how I will be side-eyed, right? So I'm wondering, this is the other experience that I had, that I got in an elevator. I live in an elevator building, and someone that just moved into my floor got on the elevator, and we're, as far as we can be from one another, we're both masked up. And we get to talking, and she says that, we were talking about the holiday. She said that she didn't do much because her son might have been COVID exposed. And while she said this, she's like, maybe I shouldn't, be in a minute, just like a snap.
Wow.
Like, did this woman just get on the elevator with me, knowing that she might be COVID? Like, I got heated in that moment and wanted to snap on this woman. So I'm just wanting to pull into the context and the conversation about how we react to one another within a pandemic, how we may have less compassion for one another, or with the numbers going up. If you have been diagnosed with or contracted COVID, you start thinking about who I could have got it from, what feelings come up, or who I could have given it to, and the feelings that come up. I'm wondering if you can speak to that experience and what we can do to engage with one another a bit better.
Yeah, I think that what's happening is that the social contract of what we expect from others has changed pretty rapidly. And, in terms of social contract, we have some rules in society where we expect people to do certain things to maintain comfort, maintain safety, give leeway when we need it. And this is a pretty rapid change. When you think about how we've developed those expectations over time, it takes a long time for people to learn those things. And in the last 9 months or so, that contract has changed pretty rapidly. So I think that we have to be a little forgiving, but at the same time have that expectation that if someone violates our safety, I think we should say something. We should be able to say, you know what, I need some space, please put on a mask, but not in a threatening or judgmental way. I think letting more of an educator way, of approaching someone and letting them know, please support my safety by putting a mask on. Please support my safety by giving me some social distance. But if you think about any cultural change, it's going to take some time. So some people will never want to change, and COVID will come and go, and they're following their own social contract, maybe a social contract of one. But allowing us to be comfortable in advocating for ourselves, and at the same time realizing that some people are going to be struggling, with making that change, because that change signifies something. It means that their world has changed. That means that their safety has changed. So being forgiving and being compassionate in our at least attempt to understand what others are experiencing.
So I have to ask a question. So I'm in Arizona, and our political climate is, as the nation knows, right? As we were one of those states, we're really just split. And with that split, at least here in Arizona, you have a lot of folks who are anti-maskers. And so I don't know how safe I would feel, or how safe others may feel who are maskers. I made up a new word, right? To approach someone and providing, even if it isn't a gentle way, education on, can you wear a mask for my safety while we're sharing this space with one another? From what I understand, there's some people who become quite belligerent if they have very strong opinions about not wearing a mask and feeling as though their rights are being violated. So how would you then suggest that people, at least in a state like ours where it's very, can't think of the word, but hostile?
Yeah. I think if someone is concerned about that, and it's probably sometimes easier to judge versus others how well that information is being received. I actually think at this point, if someone's going out without a mask, it's probably willful. But if you have a relationship with that person, for example, it might even be a limited relationship, like you live in the same building. There might be some investment of, okay, I'll put on a mask around you, and that might be enough. If it's a stranger, it's really difficult to judge. So there's a risk factor there. I often think of it as similar to other like public health changes that our cultures experience. So, for example, if someone is smoking indoors these days, in most places in this country, if you smoke indoors, you're going to get a look. You might be escorted out or asked to put out your cigarette. I think it's kind of a similar approach of the person. You don't want to be seen as violating someone's rights. At the same time, you want to be enforcing your safety. So I think sometimes you just have to create the distance for yourself. A dirty look is probably not going to be effective, at least not in the.
So no side eye. No side eye.
No, he's my go-to.
Leo, you made me think of, or Dr. Caraballo, sorry. You made me think of when I was a kid, whenever people would smoke cigarettes, I would like cough loudly, like, I'd overdo it. And I'm like, oh, can't we just do that then? Like, no.
I don't know how effective that'll be.
You know what? Maybe we can take
that passive aggressive
and then cough. Just kidding. I'm
kidding. Now, I usually recommend if you're going to confront is probably the wrong term. Approach someone. You probably want to blame it on policy or a rule. So, for example, if you know you're in a building that has a mask policy, just say that. Say, oh, you know what? Sorry, this building has a mask policy. If they say, well, I don't care, that's it. That might be the limit. It's probably not worth having a confrontation. If they say, oh, you know what? I forgot my mask. That might be a different approach. They're giving their own excuse. You might have to then say, oh, you know what? The front desk has masks. So finding a way of approaching people without the cynicism, perhaps, of more the openness of, they probably know they should have a mask on. They probably should know that they socially distance. But there's motivators to not change, and that's what's keeping them there. So if you make it easy for them to change, or if you allow them to find an excuse to at least temporarily change, I think people are more welcome to them.
Well, Dr. Caraballo, thank you so much. I really appreciate that framing of a social contract. That gives me I hope it gives other people an understanding of, what they can control and what they can't, right? Because my social contract can look very different from someone else, and we can respect that within our boundaries and do what we can do. So we can do some of those interventions that you talked about as gently as possible, or create the distance ourselves. So that can be more empowering stance. So thank you so much for joining us and sharing your expertise. It's good to see you.
Likewise.
Yeah, it's nice seeing your face. Thank you so much for joining us.
You're welcome. Thank you for having me.
Thank you. We'll see you later.
Yes.
That was funny and so true. In terms of the social contract and what I expected, I had to, get a new thing, then a side eye, because clearly it hasn't been working,
Well, not everyone knows the side eye. Some of us were raised with the side eye. Some of us were raised where we were like, oh, I should stop doing what I'm doing, right? When someone looks at you a certain way. But not everyone knows what the side eye is. Like, you might walk past them and be like,
I just have something in my eyelash.
Right.
And then they're like, I wonder why they're looking at me like that.
That's right. And then half of my face is covered, so you can't see the set of my lips.
Yeah, all they see is they're like, ooh, she has an intense glare. That's a nice eye. But she, I didn't even be catching it.
Well, Dr.
Then all that work
is also here.
Yes.
Take the honor.
Absolutely. It's such an honor to introduce Dr. John Delatorre. I've known him for years. He was recently awarded the Outstanding Early Career Psychologist by the Arizona Psychological Foundation. He's done so much in Arizona, focusing on disaster relief, COVID-related issues, trauma, public health crises. You can also find him just kind of on the side doing other TV shows and guest appearances with relation to forensic psychology. So he's definitely kind of been out and about and can offer us so much awesome and new and additional information. So come on, Dr. Delatorre.
Hello, everybody.
Well, hello.
Hi.
How are you doing today?
I'm good. How's everybody else?
Doing pretty good. Thank you for joining us.
Thank you for having me.
Welcome.
Yeah.
So you've probably heard a little bit of the conversation that we've had today with our other guests, and we've talked a lot about like the physiological symptoms that come from COVID and from mental health and issues surrounding that, fatigue. We're in a public health crisis right now, and you've definitely done so much work related to COVID and other public health crises. What do you think that we've missed so far in our conversation that we can really just kind of take to hone in on as we start to go into our wrap up?
I think there's a lot of, and rightly so, there's a lot of focus on the negative aspects of what's going on right now. But there's also some really good positive aspects that are going on right now also. I think for the most part, throughout this pandemic, what we've recognized is that there needs to be more of a conversation with the people that we don't converse with all that often. Being forced to be isolated and not to go out places has really made us sort of reconnect. Yes, virtually, but any kind of connection is a positive one. And so I think that during this holiday season, where I think a lot of people are going to be focused on this idea, well, I can't do this, I can't go that. Santa Clara County in California just completely shut down.
Wow.
So not even contact sports are going to be able to be played. So there's a lot that's going on that's very negative, and rightly I get that that's where a lot of people's focuses are. But during this holiday season, there was already stress, right? During every holiday season, people are so stressed out. The to-do list seemed like endless, right? That there's always something more to do. And I think now's the time to really focus on being grateful, to really focus on the Thanksgiving, right? That's part of this season. I think now is the time to focus on the positivity. I think there are some lessons that people can learn, particularly now. I know some family members have a hard time saying no. So there's a family gathering, there's someone that you really don't want to be around, but you feel obligated to be around them because it's family. This is your opportunity to say, I want to stay safe, right? So that you don't have to hear all of the problematic issues that you don't want to listen to. And without veering too far into politics, I think we know what family member we're talking about right now. Right? So
Everyone's got one. Some of us
during the holiday, right?
Yeah. And so now's this opportunity for someone to learn how to say no, which is a skill not a lot of people have, particularly during this holiday season. To learning how to be grateful, to getting away from the television. I know I heard your first guest talk about getting away from the TV, right? Zoom fatigue, TV fatigue, news fatigue, all that stuff's real. So maybe you break out a book. Maybe it's an opportunity for you to buy an actual physical book and read that thing. No more Kindle or anything like that. Maybe it's an opportunity for you to really think about what you feel grateful for and really focus on the positivity that is supposed to be this season, and rather than the endless to-do list and stressful that normally comes with the holidays.
Mm,
So beautifully stated.
yes. And some concrete ways of coping, and just acknowledging what is, so we don't have to stand in judgment of, oh, I shouldn't be stressed, or so on and so forth. It just is. And there are things that we can do to have a more meaningful or fulfilling experience in light of or balanced with what has been stressful. Really appreciate it.
Oh yeah.
Sounds like we also, what I heard you say is we get to take this opportunity of this pandemic to give us permission to be able to distance ourselves from those who we don't want to be around, and to be able to connect with those who we do want to, whether they're local geographically or at a distance, because we're all, as they say here in Arizona, apart together.
Absolutely. Yeah, no, absolutely. This is the opportunity now to figure out, am I feeling stressed? I heard Dr. Bro concerned about the headaches that she was getting. Am I getting these headaches because I've been exposed, or am I getting these headaches because they're a part of my regular everyday stress? Am I feeling stressed out because I'm watching so much television, or am I feeling stressed out because I don't have a job and I'm trying to get, all of my support together? What exactly is it that you're really feeling? And now is the time to kind of break away from that. I know that their first guest was talking about, we're heading towards the finish line here with a vaccine that's coming soon, and, don't stumble when you're so close. Really take stock, right? Now is the time when you're supposed to do it anyway, but now you have no choice but to really sit back and think about your feelings, reflect on what happened throughout this year in order to move forward and to have a better experience in 2021.
Yeah.
If I can ask one other kind of follow-up question to you, Dr. Delatorre, and this is more kind of a special population specific question with your experience in working in disaster relief, and maybe even doing training for people that are going out and doing the disaster relief. And it's around the experience of healthcare workers and essential workers. And I'm wondering if you have any feedback or ways of coping you can offer to the people who are potentially exposed to COVID, doing the work, that may also experience a lot of anxiety about, will I be infecting other people? Will I affect my family in negative ways? And may have some guilt or fear around that. I'm wondering if you can, give them some tools of how they can also shift to a different perspective or positivity, not toxic positivity, but finding that balance.
Yeah, one of the biggest issues when it comes to healthcare workers and those in sort of the helping profession is this need that I'm not done until everyone is good. I'm not done until everyone is safe. And that's kind of a hard mindset to kind of break through. And so what I would say to individuals who are on the front lines, EMTs, police officers, fire, plus emergency room and ICU doctors and nurses, all of the people that are truly taking care of the people that are infected, is to absolutely reach out. Just because you're away for 1 hour doesn't mean that you're no longer going to be successful in what you do. And so I've luckily been a part of a team that has started peer-to-peer groups within the hospital system, so that physicians reach out to physicians. Sometimes it's going to be very difficult for a nurse to then reach out to a psychologist, or an ER doctor like your first guest to really reach out to a counselor or something like that. But there's true bonding that can happen. Healing doesn't just happen between the client and the therapist. Healing happens when you're able to confront whatever the vulnerable feeling is, to accept it, to accommodate it, to incorporate it, and recognize that it's a positive thing. Even if it might have a negative connotations, emotions aren't meant to hurt you, right? Evolutionarily speaking, having an emotion doesn't hurt you. It's meant to help you. But sometimes we try to push those away, and it's in that pushing away that we end up getting hurt. And so reaching out to whoever you can, whether it's a peer, supervisor, even if it's just stopping, the psychiatrist or psychologist in the hallway or something like that, don't be afraid to take a few minutes out of the day to talk to someone about something other than what's going on, or if something is really major happening with one of your patients, to talk about that, So take a few minutes. Now is the time to take a few minutes, and it's going to be okay.
Break the silence around it. Yeah.
Yeah.
Powerful.
Taking a few minutes. We do have time, if nothing else, and we can't pour from an empty cup. So we have to take that moment. We have to take that step back. We have to re-engage with ourselves. And sometimes the best way to do that is to engage in that closeness with others. We all have different ways of reconnecting. And sometimes it can be as simple as a quick discussion or a smile in the hallway, or we're going to get through this, a quick pat on the back as we move to kind of those next steps. I love that.
Well, thank you so much for joining us.
Yes, thanks for having me.
For your time.
Thanks.
I hope you had a great Thanksgiving.
Yes, I hope each of you had a good Thanksgiving, and happy holidays to everyone.
Happy holidays. Thank you.
Thank you.
Bye.
Bye.
Well, that was a lot of fun.
Yeah, he speaks so eloquently. I'm so thankful he was able to join us.
Yes, absolutely. We had great guests today. And I think there's something that Dr. Delatorre indicated that I think might be a good way for us to end today. Which
I just had to add from way back when. He's going to stick with the side eye.
Stick with it.
That's my cousin. So I'm just saying, like, family.
Yeah, you got to do what works. The side eye don't work no more. My concern is tact. So if you are going to speak to someone, a stranger, especially about it, can you do it tactfully and make sure that you're like, hey, so I think Leo gave us some really good tips on how to kind of do that and be really thoughtful about how to speak, how to, assert yourself and what your own personal needs are. And that was definitely one of my takeaways is regardless of what our plans are, was making sure that we're being thoughtful about what our needs are and what our safety is, and being able to say no, to assert ourselves appropriately, as necessary or as needed, and to check back in.
Yeah. And just to kind of wrap up, so Dr. Geoffry gave us some wonderful information on vitamin D and melatonin. If you missed that, go back to the replay once this live is over. He also provided what the proper dosages are according to the research when it comes to both prevention and then also if you're actually fighting COVID. So definitely, he gave such great information that I know I'm going to be stocking my medicine cabinet with some additional vitamin D, melatonin, and zinc. So again, thank you, Dr. Geoffry, if you're still out there watching us. Appreciate you. Dr. Evelyn, Dr. Burrell, Dr. Melton, if you want to give a wrap up with your thoughts.
I really appreciate it, guests, as well as you ladies, and the laughter, because that is another way to not disrupt, but complete the stress response cycle is some laughter. And so I appreciate this moment, as well as the concrete things that we can do that our guests offered. So feeling empowered, right? And not just like kind of having to bear and grit through it, but empowered that there are things that I can do when there's a lot out of my control. So.
Right. The saying, I love to laugh. So I try to do that often and well. And I agree. I actually got a lot of new information today that I hadn't really considered, that I hadn't thought about. And so just kind of my own takeaways and things to think about. My headache has subsided since we started today, which is great. I'm like, hey, look at that. It's going away. So something worked.
I know.
It's gone for now. But it might pop back up once my kids walk through the door. Like, oh, man. But either way, it's it's always just so much awesome information and great takeaways. And I just want to thank you, ladies. We've just kind of speaking to what was offered as being thoughtful and thankful, and this is the season. And I'm so thankful for you two. And everything that you've brought into my life, and just being able to know you and to talk to you and to have you as colleagues and friends, and know that when I'm tripping over something, you're going to answer the phone. I'm like, that you'll listen and kind of engage with me. And so I just really want to thank you and let you know how much I appreciate having you as part of my life. So thank you.
Well, I love you both.
Yeah. All right, you guys. So that's our wrap up today for 3 Psych Docs. Will, I guess, join us next month. Are we going in December on the 20th?
I don't know. Let's think about that.
We'll have to think about that.
Yeah, we're going to think about that. And we'll let y'all know. Holidays.
Right.
I'm leaning probably on a yes. However, that lean is like at a 51.
What's up? Because I'm like looking at my calendar. I might actually have something going on already. So we'll
And,
see.
yeah. You know, everybody deserves a break. So, oh, Sonia Wesley, thank you. Thank you. We're getting some rounds of applause. So thank you everyone for joining us, for laughing with us, for learning with us, for giving us your time today, whether it is that you are watching us live or if you're watching the replay. We definitely appreciate you giving us what is our most valuable asset, right? And that's our time. And
Absolutely.
so I just want to thank you, thank you, thank you. And we will see you next time.
Happy holidays, everyone.
Happy holidays.